Hello everyone, welcome to Pediatrics by Dr. Anand, and today's topic of choice is this. What can you see in this baby? What do you call this condition? It's a very nice syndrome, a condition. Any idea what is the name of this condition? So this is nothing but known as amniotic band syndrome. Okay, amniotic band syndrome. It is also known as constriction ring syndrome. So what are the important points regarding amniotic band syndrome? For that you have to know something known as chorion and amnion. So see what happens. See, the developing fetus floats in the amniotic fluid in the mother's uterus, right? What keeps the fluid around the fetus and in the uterus is nothing but a sac. I hope you know that. And this sac has two layers basically. The outermost layer which lines the uterus is a chorion, and the layer closer to the fetus is called the amnion. Okay, that much you should understand first. So it is believed that amniotic band syndrome occurs when the inner membrane, which is the amnion, ruptures or tears without any injury to the outer membrane, that is the chorion. Are you understanding? So the developing fetus is still floating in the fluid but is then exposed to the floating tissues or bands from the ruptured amnion. Okay. So this floating tissue can become entangled around the fetus, and that can cause entanglement of the digits, limbs, or any other parts of the fetus, and that is nothing but amniotic band syndrome. And basically the amniotic band syndrome does not appear to be genetic or hereditary, so the likelihood of it occurring in another pregnancy is less likely or less common. Okay, and now two important points regarding this complication from the amniotic band syndrome. So complication could be mild to severe. In mild cases, what can happen? The band can wrapped around the digits or finger or toes and can lead to amputation of the finger or toes or syndactyly, which is nothing but abnormal fusion of the digits. In other chances, the band can wrapped around the limb or the arm or the leg, leading to the restriction of the movement, leading to deformities such as club foot. So that's all regarding the amniotic band syndrome. And fetus with amniotic band syndrome may require treatment after the birth. Basically, you do a reconstructive surgery. It might be needed to correct the deep constrictions or something like fused fingers or toes or cleft lip or a club foot. And it depends on the extent of the deformity of the amniotic band. It depends your child's surgery. That's it. So that's all about the amniotic band syndrome. Thank you so much for watching. And if you are a part of my WhatsApp group, then fair enough. If you are not a part of the pediatric WhatsApp group, so for the daily audio or video series MCQs discussion, you can WhatsApp on 9999897081. And if you are international students, then you have to use +91. So that's all, and thank you.